On this channel, my goal is to really help PAs and NPs find an area of medicine to work in that's really going to bring them fulfillment and make them happy and give them that joy to go to work every day. So today I'm going to be interviewing a PA who works in breastfeeding medicine. And you may be wondering, well, what the heck is breastfeeding medicine? And it's kind of like a lactation consultant, but mixed with more medicine. And she's going to tell us about the specialty, about what she does, and about what she really loves about the specialty and kind of some of the downsides of it. Now, let's get to the interview and learn about this unique specialty.
My name's Meredith Young, and I have been a PA since 2009.
So, hi, Meredith. Thanks for joining us today.
Yeah, thank you for having me.
So, we're talking about something a little bit different that I actually didn't even realize was a thing that PAs can do until somebody emailed me and asked me about this. And that led me to you. So, tell us a little bit about your PA journey and what it is that you're doing now.
After I graduated, I actually went into emergency medicine, and I did that for about 8 years, and that was kind of where I had started. That's how I kind of got into becoming a PA. But after working in the ER for 8 years, I was kind of feeling like I needed something different. Was feeling a little burnt out, and just feeling like it didn't really fit my family lifestyle after having kids, and felt like I needed a change. And I left the ER for a short period of time and went to a therapeutic boarding school I was their health center director for about a year and a half, and realized that wasn't really for me either. So did a little exploring and ended up in breastfeeding medicine. And so that's what I do now. I've been in this role for about 5 years now and really love it.
Yeah, so we're going to talk a lot more about the breastfeeding medicine and lactation stuff, but I know that people are going to have the same question I had. So really quick, I want to hit it. What is that therapeutic boarding school? What is that?
Yeah, so it was a school. They do have some day students, but mostly boarding students, obviously, that need extra help and support. They mostly have patients that have like behavioral issues, trouble getting to school. They have therapists on staff and a lot of like extra support around them. Because of that, a lot of the kids were on medications. So as a health center, we dealt with, kind of managing a lot of the medications and supplements, and then any obviously health issues that come up like a normal, school nurse would do.
So when you say breastfeeding medicine, is it similar to being, or are you a lactation consultant?
Breastfeeding medicine is a lactation consultant, but it's also somebody that does medicine. So somebody that can prescribe, somebody that is doing a little bit more just than like counseling, because there are different types of lactation counselors, right? So there's lactation counselor, and there's different ways to become a lactation counselor. There's different programs. A lot of people have heard of like the certified lactation counselor through Healthy Children Project, which is like a very basic 40-hour course to go over the basics and how to help support families. The next level from that is an internationally board certified lactation consultant. And there's different pathways to become one of those. Basically, they break it down into like three different things that you need. And then there's three different ways to get those things. So you need to have like basic science classes. You need to have 95 hours of lactation education, and then you need a certain amount of hours working with families. So depending on which path you're taking, you do different numbers of things. So having already been in medicine, I had my science kind of checked off, did my 95 hours of courses, and then there are two different paths you can take. Pathway one is if you are already working with families in lactation, you can count those hours and get 1,000 hours, then sit for the board. I chose pathway three, which is that you have to work directly with a mentor in seeing all of the dyads, because I came from emergency medicine and a boarding school with older kids and didn't have a lot of experience with babies. And so I wanted, number one, to make sure I, was well educated, knew what the heck I was doing. And I also, it felt like it was the easiest way for me to get those hours. There is a pathway two as well. That one is that you can go to like an accredited lactation program and do 300 hours.
So there are other people that are getting this certification that are not, medical providers. But when you're working in your clinic, you're actually billing as a regular PA. So Tell us a little bit about how your what the clinic is that you're working in, the structure of the clinic, and how that billing works.
So I work at a hospital-based clinic. We have an on-site at the hospital office, and then we have an off-site office. And when we are billing, we're billing based on time because we spend a lot of time with our patients. So all of
Okay, stop right there because every PA that's and NP is watching is like, wait, you spend time with your patients? It's just like unheard of in medicine nowadays. So I didn't mean to
yeah,
interrupt you, but that's just can't gloss over that. That's got to be great to be able to have to spend the time.
it is amazing. I feel like I've kind of found a unicorn.
Yeah.
And I know not all offices work this way, but ours we get 90-minute slots. We don't like have separate charting time or separate lunch time. Like, and that's the way I've chosen to do the schedule is I just run like 90 minutes from when the minute I start to the minute I end. And then I just fit things in because not all appointments are going to go 90 minutes.
Right.
I'd say the majority go at least 60 minutes, if not 75 minutes. And then some, go over the 90 minutes, but we really try to keep it. So yeah, it's really great that we have so much time.
So you say you have these great 90-minute slots for appointment stuff. So what are you working on a 5 days a week kind of clinic, and what kind of time are you actually coming to the office and leaving every day?
So I work part-time. So I work Tuesdays, Wednesdays, and Fridays, and my schedule, I start at 8:30 and I'm done at 5. I have a tendency to to stay a little bit later just because that's the kind of person I am. But I'm usually home by 6. So, not staying like crazy hours over.
So what are kind of like the typical cases? Because you say it's you do more things beyond the lactation consultant. So in these 90-minute visits, kind of what's happening?
It obviously depends on what the family is coming in with, but I would say a typical visit of like a postpartum visit would be a family coming in, having some issues with either getting baby to latch or with milk supply. And so we usually start with like the latching part. Like let's see what the baby's actually doing. Let's see what they can do. We're evaluating the oral anatomy on the infant. We're assessing any injuries on the breast or chest, and we're kind of seeing how things are working together. We also like weigh the baby. So, we want to make sure the baby's not losing weight, the baby's gaining appropriately. We do weighted feeds. So after we weigh the baby and the baby is fed, then we weigh them again, make sure they're transferring well. And then if they're doing any pumping, then we do a pumping assessment, which is sitting down and pumping with them, making sure that they're using the pump right, make sure that they have the right flange sizes, giving them kind of any tips or tricks to kind of increase supply if they need to, or decrease supply. Sometimes people have too much and we're actually working on decreasing. And then, it depends. We see families, where the parent has mastitis. And so we're prescribing antibiotics for that and managing that. If we have any concern about an abscess, then, we're ordering ultrasounds and sending them for incision and drainage or aspiration, kind of depending on what's going on, or if they need a breast surgeon referral. If we have an infant that has like a tongue tie, then we're referring them for release of that. I know some breastfeeding medicine people do their own tongue tie releases. In our office, we refer to ENTs or dentists for the release. When we're working with people that have low milk supply, sometimes we're prescribing medication to help with that or using supplements to help them increase their milk supply. And then sometimes, like I said, some people have too much milk supply. So sometimes we're also prescribing medications to help decrease milk supply too. So it really depends on like what the picture is and what's going on.
That kind of leads me to my next question is you work in a specialty clinic where that's, the focus, breastfeeding medicine, but can this be incorporated? Can people who work in OB or pediatrics or even family practice, is it possible for them to get certified and kind of incorporate this into their practice?
Yeah, absolutely. So we're seeing more and more of that because I think that there's definitely a need for the support for these families. And so yeah, some people will, be an OB, but they'll see, lactating patients, and often they are billing for both. Like they'll bill for both the parent and the baby. Some don't feel comfortable with that because they're like, we're certified in OB, like so they'll just bill for the parent and vice versa. Like in pediatrics, sometimes they only feel comfortable billing for pediatrics. So I've met different offices that do different things. Definitely met pediatric offices that just bill for baby, and then I've met others that do both.
But in your clinic, because it's breastfeeding medicine in general, do you guys bill for both mother and baby?
So we are a unique entity because we are a big hospital system. Right now, they are only letting us bill for one. We're actively trying to to work with that and to be able to bill for both. I would say most breastfeeding practices bill for both.
And so patient population that you see, obviously, these are going to be, breastfeeding mothers, but is there like, do people come see you before they even give birth? And then after they give birth, is there like a time limit or an age limit of the baby when you kind of stop seeing them?
Yes, number one, we definitely see patients beforehand. I teach just a lactation course, like basic course for new families, and then I also that I don't bill for. That's like a just like if they want to pay for a class kind of
Okay.
situation. But then I also do prenatal appointments, and that's like a one-on-one appointment that we do bill for. And those are usually patients that have either had, poor experience with a first child and feeding them and want extra help, or they have some type of risk factor where they have, diabetes or gestational diabetes. They have, they've had some type of surgery or some, that might affect it. And we're concerned about, their ability to make milk. And so sometimes we're just seeing patients that have a lot of anxiety about it. And just to give them extra support and create a good plan for them and their family. So we definitely do see that. And then I would say the majority of our patients are like in the early postpartum period where they're a month to 2 months, and we follow them if they need following. We sometimes will see patients even older if they're having any issues with like introducing solids or any issues with weaning, or if like any issues develop, if they develop like a blood duct or mastitis or something like that, then we'll help them all along the way. So yeah, I definitely get babies that are 2 years old or 3 years old, or that the parent needs help with. Whatever situation they're in. It's just the majority of patients are in the early weeks to months, I would say.
So when you talked about the procedures, like you had mentioned, like if there's an abscess, then you send them to have incision and drainage. So are you doing any procedures in your clinic, or do you guys send them all out?
I send them out. We're not doing any procedures at this time in our office. It's something that we've thought about doing. We just don't have access to like ultrasounds and some of the like bigger things that we need right now. So at some point we might do things like that, but we're not at this time.
But it's conceivable that there are lactating clinics out there that are doing their own procedures and stuff. So if somebody was interested in doing this, that is a possibility if
Yeah,
it's right for their clinic. Yeah.
exactly.
Yeah, this seems as you were talking and stuff, I keep thinking the thought keeps coming back to me that this could be a great opportunity for PAs or NPs, depending on state rules and things, to kind of have your own specialty business doing this. Do you know of people that have done that, that have opened their own clinics and just do the lactation consultant and do the prescribing mastitis and things like that? It seems like you wouldn't have to have a whole lot of equipment or a huge clinic to do that.
I don't know many that have done it. I do know some nurse practitioners that are more just like acting as, using their RN license more so to do lactation. And they're not so much doing like breastfeeding medicine stuff. They're not prescribing that role and stuff like that. But I definitely like could foresee that happening. But I don't personally, I'm sure there's somebody out there that's doing it.
But I would think that if you just do kind of the lactation consultant side without bringing in the medical side, of being a PA and stuff, that you wouldn't be bringing in as much income.
It it's interesting because there's different ways. A lot of lactation consultants will do, like, out-of-pocket paying. So, if you go through insurance, it's gonna be a little bit different, and so it's kind of like, what hassle do you wanna go through, and what can you get clients to do too? So, yeah, I think probably people would make better when using their PA license, but it kind of depends how things are set up.
So have there been anything in this specialty of breastfeeding medicine that has been kind of a surprise to you that's been different than what you thought it would be?
A lot more medicine, I guess, than I thought. Like, when I first started the field, I thought it was gonna be mostly counseling, which obviously a lot of it is counseling, but I'm kind of surprised by how much medicine I do pull into it. I think the relationships and, like, working with patients has been awesome. Like, obviously had worked with patients before, but it's a very different, like, type of relationship. Like, you get really close with some of these.
I say it seems very intimate.
Yeah, it is, and it's, like, very rewarding. I mean, obviously, it was part of why I wanted to change is because I wanted a field that I felt more rewarded in, and I love, like, being able to see things through. A lot of times patients will send me messages like, "We're 6 months out," or, "We're a year out," and, like, "Everything's going great," or, not all of them go that well, right? Like, but even the ones that don't go well, it's still, like, usually a nice, like, relationship, and you feel really rewarded and just, like, helping them support them even through, like, a difficult time, even if it, isn't exactly the journey that they imagined, kind of helping them reimagine things is really nice.
So you just talked about like what are the great aspects of this specialty and what you love about it, but what are some of the challenges? What are some of the negative things that people may not think about or realize if they're looking to get into this specialty?
Yeah, so I feel like, having just come up of like the good things, it sometimes can be a bad thing too. Like sometimes these relationships are because you can become very invested in them, they can be really draining too. Like I have some patients that leave the office and I'm just like, oh my God, I'm exhausted. Like that they just took so much energy out of me because they needed so much support. And not every patient obviously needs that, but I didn't think of that going into this, that sometimes it would take, so much. Another like aspect is because I work for a big hospital, like there's a lot of hospital, red tape kind of stuff. I feel like there's plus and minuses of that, right? Like there's things that I can do because I am part of a big system, but then there's other things that like I want to do that, I can't get the system to do. So I think that that's a little bit unique to my situation, but yeah.
And I would imagine I'm not trying to paint postpartum women as all crazy and terrible and stuff, but I mean it's just a fact. There's a lot of hormones going on. I imagine that, and it's especially if it's maybe their first child and stuff. I imagine there can be a lot of tears and a lot of frustration and a little bit of contention because of just their frustrations.
Yes, absolutely, definitely. We have a tissue box right on our desk, and we say, it's normal, it happens. There's a lot of emotions, a lot of hormones, and that's like, some of the great part is to be there and help them through that. But yeah, there definitely can be a lot that goes with it.
So, what are the kind of the top traits or personalities that you think would really enjoy this specialty?
Yeah, definitely people that like to, develop strong relationships with patients and feel really comfortable with people because you do, often see them for a period of time, but then sometimes they come back with their second and third child too. So sometimes it's nice to develop those relationships. The other thing I would say is it's easy to talk about things, right? Like you don't get squirmish about things. Different things come up in our appointments that you would not even think would be questioned. And so, yeah, just being able to level with them and, talk to them about different things is definitely important. The other thing that I think is really helpful is a person that can like separate their own experiences from the patient. Because sometimes it's a field where, if you had one experience with your children, it can be really easy to put those experiences or, think that these people want the same thing or, have the same goals as you. So being able to like separate, I think is really, really important. And like what you might feel comfortable with might not be what they feel comfortable with too. Just, some people are really comfortable nursing in public and other people are not at all. And so just being able to understand those differences, I think is really important. On a like medicine perspective, I think it's really helpful to be able to like have a good grasp of like hormones and how they, work and interact can be and just how the body works in that way is helpful.
Are there any good references that you know of for this specialty? Like, are there breastfeeding medicine societies that have trainings and anything that you can mention and suggest to people who want to kind of start learning about this aspect of medicine?
There's the Academy of Breastfeeding Medicine, which has some great resources. They actually have protocols too. So even if you're not in breastfeeding medicine, even if you're like working in the emergency room and you come across a patient with mastitis, there's like a mastitis protocol. There's another organization called iAble, and they do a lot of education. They have courses. There's also like a list serve where you can ask questions, and people that, work in breastfeeding medicine will answer. And they're just a great, they also have a podcast too, which is very informational, where they'll like go through studies and talk them. It's kind of like a journal review kind of podcast. That's really helpful. And then there's other just like lactation societies, like there's Gold Lactation or iLactation, or ILCA is the International Lactation Consultant Association, I think is what it stands for. And they do a lot of like education and training. They have a lot of like conferences and just like training options. And then like the last thing that is Hales Meds. Hales Meds. Thomas Hale writes a book called Hale's Medications and Mother's Milk, and he has an app too. So even if you're not in, like if you come across somebody and aren't sure about safety and stuff, he's like a great resource for medications and safety. I love Thomas Hale. His app and his book are fantastic, but they also have a hotline too that you can call. So if you ever run into like a situation, you can just call them and they'll talk you through it, and they're super helpful. I've called them many a times.
Well, I'll have links to all that stuff down below in the description box. When I do these videos, I always try to look at it from whether this is a good specialty people can transfer to if they're already working in another specialty, or if it's a good specialty for new grads. Do you think that this is something that would be good for new grad friendly, or do you think that they really should get a couple years of basic family practice or pediatrics before they go into this?
I think it would very much depend on the grad and what their past experience is. If they are a parent and they've, been volunteering at La League or Breastfeeding USA, which are, they have a background in it, then I think it could be appropriate depending on, the collaborating physician that, and the relationship there. I think it could be a possibility, but I think it would have to be like the right new grad, because otherwise, it I think would be hard because it is so autonomous that you would, need a lot of like counseling, some type of like counseling background, I think, if you didn't have any other experience.
If somebody is kind of thinks that they might be interested in this, but they're not really sure, would you recommend that they do some volunteering to get an idea of what it's like to be in this world?
That's actually kind of how I got my foot in the door, or how I started experimenting with if I wanted to, make this career change. Was I started going to support groups, and I had a young child, so in the beginning I just started attending them, and then somebody was like, "You come a lot, like you seem to like this. You should think about this." And then I spent a lot more time, and I find it, helpful to kind of get an idea of, yeah, what you're getting yourself into. And then that actually opened a lot of doors for me too, because I made contacts with people in the field and was able to like develop relationships with some of the nurses that were working in the hospital, because I was volunteering at the hospital support group. And then when they wanted to open this clinic, they were like, "Hey, would you be interested?" And so it really, for me, it really like, I feel very lucky because it worked out that way. But I do think it was a great way for me to be like, okay, yeah, this is what I want to do. One of the pathways to becoming an IBCLC does allow you to use your volunteer hours. So that pathway one, if you have, your sciences checked off, which if you're a PA, you do, but you can count the 1,000 hours, you can count with volunteer work. So if you were, working with any of the volunteer agencies, you can count those as like getting your certification too.
And will you kind of name those what were the places that are common that people volunteer with?
There's a whole list on the IBCLC website, but the most common ones in the US are La League and Breastfeeding USA. There are some like breastfeeding cafes that I'm pretty sure like have connections to, but those are like the most common ones that people volunteer at. And then sometimes like personal hospitals will have their own support groups. And sometimes even communities will. Like one of the ones that I volunteered at was just a community like resource center that had a support group too. So sometimes there's like different areas to look that have them.
Well, anything else that you want to talk about breastfeeding medicine that I didn't mention, or any last summary or shameless plug for this specialty that you want to put out there?
I think that this is like an amazing field that has a lot of potential for growth. And I think that it's a field where a lot of families need this support and don't have access to it. And I think that we could be a good way to, open up more options for our families. And, it might not be one of like the highest paying fields, but I find it very fulfilling and a great like work life balance. And I think that that is at least for me, that was very important, and more important than, some of the other things.
Awesome. Well, thank you so much for joining us today and sharing this great information. I appreciate your time.
Thank you for having me. It's nice to share all of this with other people, and I hope others will join me.
Really interesting specialty that I didn't know even existed for PAs and NPs. But if this isn't quite what you're looking for, and maybe you're wondering what it's like to work in OB medicine and want to know if PAs and NPs can deliver babies, then watch this video here. That's it for today. Thanks for joining me. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.